Intro to Clinical Pharmacology, Unit 2. According to Unit 2, we are going to be covering medication administration. The chapters we're going to be covering are Chapters 1, Pharmacology and the Nursing Process as an LPN. Chapters 2, Legal, Regulations, and Ethical Aspects of Drug Administration. Chapter 3, Principles of Drug Administration. Chapters 4, Drug Calculation, Preparing and Giving Drugs. And Chapters 20 will always be involved in every chapter that we cover in Pharmacology 1, 2, and 3. And Chapter 20 covers over-the-counter drug therapy. We also have videos that are posted on Moodle under the tab labeled Lab. Also inside of your Evolve account, supported by Elsevier, under Chapter 4, Student Resources, there are videos about medication administration. Those are also required for you to watch, associated with our lab on day 5. Chapter 1, we have some key terms: 9 rights of drug administration, a series of nursing actions to protect the patient from drug error, adverse effect, the drug effect that is more severe than expected and has the potential to damage tissue or cause serious health problems. It may also be called adverse effect, toxic effect, or toxicity, and usually requires an intervention by the prescriber. Assessment, the first step of the nursing process, involves gathering information about the patient that will be used in planning care. Clinical judgment, an observed outcome of both critical thinking and decision-making. Contraindication, a health-related reason for not giving a specific drug to a patient or a group of patients. Diagnosis, a name or label for the patient's disease or condition. Expected side effects, unintended but not unusual effects of a drug that occur in many people taking the drug. The effects are usually mild and do not require the drug to be stopped. Evaluation, the process of determining the right response by looking at what happens to the patient when the nursing care plan is put into action. It is an appraisal of the treatment effectiveness. Healthcare setting, a setting in which the LPN, VN practices nursing. Identifiers, information used to reliably prove that an individual is the person for whom the drug treatment is intended. Identifiers may include the person's full name, medical record identification number, birth date, or telephone number. Implementation, the act of carrying out the plan interventions. Nursing process, a system to guide the nursing work in a logical way. It consists of 5 major steps. 1. Assessment. 2. Diagnosis. 3. Planning. 4. Implementation. And 5. Evaluation. Objective data, information that can be seen, heard, felt, or measured by someone other than the patient. Planning, using information about the patient gathered in the nursing assessment to set short-term and long-term goals. Subjective data, reports of what the patient says he or she is feeling or thinks. Therapeutic affect the intended action of the drug, also known as drug's beneficial outcome. The LPN, VN's role and the nursing process. Licensed, practical, or vocational nurses, known as LPN and VNs, play a vital, important role in providing nursing care for patients and families across the lifespan. The need for a well-educated LPN, VN workforce is predicted to grow even faster than the average rate for all other occupations. The factors that increase the demand for LPN and VNs include an aging nursing workforce reaching retirement age, an aging population in general, and an increased number of people who are living with chronic and complex illnesses. LPN VN practice has shifted dramatically over the past decades, from the time when most graduates practice in acute care settings, hospital-based care, until today, when graduates practice in a wide variety of long-term and community-based settings. LPN and VNs practice in nursing homes, assisted living facilities, outpatient clinics, home health agencies, psychiatric and behavioral health facilities, hospice, rehabilitation centers, and other settings. No matter the setting, as an LPN VN, you will share a responsibility with registered nurses, known as RNs, and other members of the healthcare team to provide safe, quality, and cost-effective care. Wherever you choose to practice, it is likely that drug administration will be a significant part of your role. A survey of new LPNs, VNs revealed that about 40% of work hours involved providing care related to giving drugs and to monitoring patients receiving drugs, including parenteral therapies. Before we begin discussing specific drugs, we review the nursing process as it relates to drug administration. Although you may be familiar with the nursing process, we are going to focus on how you will use it as you safely give drugs to patients in a variety of settings. To review the nursing process, it is a system that guides the nurse's work in a logical way. The nursing process consists of 5 major steps. 1. Assessment. 2. Diagnosis. 3. Planning. 4. Implementation. 5. Evaluation. Assessment is the first step in the nursing process, and it involves collecting important information, also called data, about the patient that will be used in the planning of care. An RN is typically assigned as the staff member who must perform the initial full assessment for each patient. As an LPN, VN, you will often make vital contributions to this assessment. The first step of the process is important because it provides initial information as you begin to make a record for developing the plan of care. The first part of assessment related to drug administration involves gathering information about the patient and the patient's health condition before you give the drugs. When the patient is admitted to the healthcare setting, any setting in which the LPN, VN practices nursing, you can obtain that information by talking to the patient or to his or her caregiver if necessary. Checking the patient closely for signs and symptoms of illness, viewing past medical records, and viewing information the patient may bring with him or her. Ask carefully about current health problems, a history of illnesses or surgeries, and drugs, including over-the-counter, we abbreviate over-the-counter OTC, drugs, and herbal or dietary supplements, taken now and in the past. This information is important for all team members and helps everyone to plan the patient's care. Information in the patient's history often directs the nurse and the physician to look for certain physical signs of illness that may be present. Information you gather through assessment falls into two groups: subjective data and objective data. Subjective data are reports of what the patient says he or she is feeling or thinks. For example, if a patient reports feeling nauseated after taking a drug, you must accept the patient's word. You cannot see, hear, or feel the patient's nausea. That is why it is subjective. A patient may state that he or she has trouble breathing, although you may observe rapid breathing. The degree of difficulty the patient feels cannot be measured. Information is subjective if you have to rely on the patient's words, or if the symptoms cannot be felt by anyone other than the patient. In such cases, you would report the patient states that blank, and you would put this in parentheses. Other examples of subjective data that you may learn about from a patient interview are the chief problem according to the patient, and you would put this in the patient's own words. The patient's belief about what caused the problem is, and you would describe that. The patient's description about what relieves the problem is, and you would describe that. The patient's report of the severity of the problem is, and you would describe that. You want to be matter of fact and put whatever the patient says in direct quotation. Objective data are data that can be seen, heard, felt, or measured by someone other than the patient. They include information obtained when the healthcare provider performs a physical examination or orders laboratory tests, X-rays, or other diagnostic tests. The RN or physician typically conducts a comprehensive physical assessment. As an LPN/VN, it is important for you to assess vital signs, respiratory rate, pulse, blood pressure, weight, height, temperature. Physical findings based on careful observation, auscultation, which is listening with a stethoscope, and light palpation as appropriate for your clinical setting and your state Nurse Practice Act. Other examples of objective data include presence of edema, quality of a cough, percentage of foods eaten at a meal, measures of intake and output. It is especially important to gather subjective and objective assessment data when the patient is first seen on admission to the healthcare setting. The initial information can be used as a baseline for comparison as care progresses. In addition to the physical examination, it is important to gather a thorough patient history. Asking questions and listening carefully to the patient may be just as important as the physical examination or the results of laboratory tests. The LPN/VN is often with the patient, so he or she plays a very important role in continuing to listen to what the patient says and reporting new information to the other healthcare team members. The nurse may not always be the one gathering the subjective and objective data. However, the nurse and everyone else on the healthcare team should learn whatever information they can from the chart, the physician, the family, and other team members and use that information to plan the patient's care. Understanding the difference between subjective and objective information can help you in reporting or charting the information. Based on our previous example, if the patient reports nausea, which is subjective information, your charting should say, the patient reports nausea, rather than the patient is nauseated, because you do not objectively see nausea. However, if the patient vomits, objective information, you will record the time, color, and amount of what the patient had vomited. Much of your role in assessment may be reported data you collect and give to the RN or to the other members of the healthcare team. The primary role you play in assessing the patient is defined by your State Nurse Practice Act, which lists what actions LPN and VNs may or may not do. Your role also may vary according to your healthcare settings, policies, and procedures. Factors to consider in assessing the patient. Certain information is very helpful in planning the care of patient who is receiving drug therapy. The baseline nursing assessment is conducted at the time of the patient's admission to the healthcare setting. An important part of the assessment is the patient's drug history. The patient is typically the best source. However, you may also include reports from caregivers, such as a spouse, close relative, friend, and past medical records, often in the electronic medical record, an EMR or EHR. When asking about the patient's drug history, you will want to collect data in the following areas. Number 1, symptoms, signs, or diseases that explain the patient's need for a drug, such as high blood pressure, high glucose levels, or pain. Number 2, the names and, when possible, dosages of all the drugs the patient is taking, including prescription drugs. Patients often forget to mention birth control pills and implanted birth control measures, over-the-counter drugs such as aspirins, vitamins, laxatives, cold and sinus preparations, antacids, alcohol or street drugs for recreational purposes such as marijuana and cocaine, alternative therapies such as herbal agents or nutritional supplements. Number 3, any problems that the patient has had with drug therapy, for example, allergies. Include the name of the drug and the symptoms that the patient experienced. Diseases that may prohibit or limit use of some drugs. Example, sickle cell disease, glucose 6-phosphate dehydrogenase deficiency, drug addiction, immune deficiencies. Data collection in all of these areas is important because this information can help prevent drug interactions or complications of drug therapy. You will also use the information as you monitor the patient's response of any changes in patient condition or status that may influence drug therapy during the time the patient is in the healthcare setting. This will help you determine whether the drug is helping the patient. After all the data has been collected, the nurse and other healthcare team members must make a diagnosis, which is a name or label for the patient's disease or condition. The physician decides on the medical diagnosis. The RN determines the nursing diagnosis. Although you will come to some decision about how sick the patient is and how carefully you need to monitor him or her, your role does not include the development of formal diagnosis. Nevertheless, you will use knowledge about the diagnosis as you contribute to the plan of care. Examples of follow-up questions you will need to ask related to giving drugs are: what are the major health-related problems of this patient? What drugs is the patient likely to require? What special knowledge or equipment is required in giving these drugs? What special concerns or cultural beliefs does the patient have? How much does this patient understand about the treatment and drugs prescribed? What factors affect the patient's ability to care for himself or herself? Answers to these questions: 1. Help you contribute to the goals of the nursing care. 2. Affect strategies you will use to care for the patient. And 3. Tell you what type of patient teaching will be needed. Answering these questions may be more challenging with children, older adults, or people whose language or cultural is different from yours. However, just as a physician must have the correct diagnosis to prescribe the right treatment, finding the correct answers to these questions helps you plan the best care for the patient. Based on the data you help collect, the medical and nursing diagnoses are made. Goals are set, and nursing care plans are written. As a member of the healthcare team, the LPN/VN will be able to assist with the planning step. The nursing care plan involves collaboration with nurses and the patient's caregivers. Using the information gathered in the assessment about the patient's history, medical and social problems, risk factors, and how ill the patient may be, goals are set on the short-term or long-term basis. For example, the following short-term goal may be written. The patient will describe pain at a level of 3 or below on a scale of 0 to 10, 30 minutes after receiving a drug for pain. An example of a long-term goal is the patient will demonstrate how to rotate injection sites for using his insulin pen by the time of discharge. Drug orders and the nursing care plan. Physicians, nurse practitioners, nurse midwives, nurse anesthetists, clinical nurse specialists, and physician assistants may write drug orders according to individual state laws. Large hospitals may have a staff hospitalist a physician or nurse practitioner who practices in the hospital to oversee care for all patients. Teaching hospitals may have resident doctors who are still in educational programs. After a drug is ordered, the nurse must verify that the order is accurate. This is usually done by checking the drug administration record or electronic medical record, EMR, against the original order. You will need to learn and follow the procedures of the agency where you work when checking drugs and drug orders. In all care environments, you must carefully check each time you give a drug. This is essential to maintaining patient safety and minimizing the risk for error or adverse effects. Factors to think about in planning to give a drug. Number 1, decide the reason for each drug to be given. Number 2, learn the information regarding the drug. Number 3, plan for special storage, techniques, or equipment. Number 4, develop a patient teaching plan. The factors to consider in planning to give a drug. Planning to give a drug involves 4 important steps. 1, know the reason you are giving the patient the drug. In other words, what is the drug supposed to do for the patient? Number 2, learn specific information about the drug, including the major action of the drug, the negative side effects that may develop, the usual dosage, route, and frequency, situations in which the drug should not be given. Those are also referred to as contraindications. Main drug interactions, the possible influence of another drug given at the same time. 3, plan for special storage requirements, procedures, techniques, or equipment that may be needed. Does the solution need to be shaken before it's given? Should the drug be refrigerated at any given point or time? Do you need a specific syringe, such as an insulin syringe? What special techniques are necessary for giving this particular drug, such as using an inhaler or not applying pressure to the site after giving certain injectable drugs? Number 4, developing a teaching plan for the patient, including what the patient needs to know about the drug's action and side effects, what the patient needs to know to take the drug correctly, what the patient needs to report to the nurse or physician if there are any problems. As you develop your plan, be sure to use the data you gathered. In the assessment and your knowledge about the drug, you will use this information as you prepare to implement your plan. Whether to give the drug you will depend on your assessment, your knowledge, and your professional judgment. The planning step of the nursing process is also the time to gather any special equipment you will need to give the drug, such as intravenous, IV infusion pumps, alcohol wipes, or nebulizers. Review special procedures you will need to give the drug, such as the Z-tract injection technique or the Z technique for giving a rectal suppository. All of this information is documented in the nursing care plan, in the paper chart, or the EMR so that other team members can see the plan. After a drug is ordered, the nurse must verify that the order is accurate. This is usually done by checking the drug administration record or electronic medical EMR against the original order. You will need to learn and follow the procedures of the agency where you work when checking drugs and drug orders. In all care environments, you must carefully check each time you give a drug. This is essential to maintaining patient safety and minimizing the risk for error or adverse effects. The nurse must also apply knowledge about the drug to the specific drug order to determine whether the drug and the dose ordered seem to be correct. No part of the order or the reason for giving the drug should be unclear. Any questions about whether a drug is appropriate or safe for that patient must be answered before the drug is given. The EMR may alert the nurse if there is a problem with the order. However, good clinical judgment in carrying out the drug order is very important. In Chapter 2, there is a list of information that is required for a clear and legal drug order that we're going to get into when we get into Chapter 2.